Now comes vitamin K. This is very important. Vitamin K is a very paradoxical vitamin. Kyun? 2, 7, 9, 10, which are the clotting factors, it is responsible for producing. It is also responsible for producing anticoagulation factors, which are protein C, protein S. अगर विटामिन K की deficiency हो गई तो क्या हो सकता? 2, 7, 9, 10 are deficient, hence there is a tendency for bleeding. Protein C, protein S deficiency is there, hence there is a tendency for clotting, because they are antithrombotic factors. But generally there is a tendency overall for bleeding. And between protein C, protein S, 2, 7, 9, 10, which has the shortest half-life? No, protein C, protein S. Protein C, protein S. Why it is important? Why it is important? Because what is the common anticoagulant that we give to the patients? Warfarin. Warfarin is what? Anti-vitamin K. When you give a anti-vitamin K warfarin, between protein C, protein S, 2, 7, 9, 10, which is the first to fall down? Protein C, protein S, which are normal, natural anticoagulants. अगर वो fall हो गया है तो there is a procoagulant tendency. Agreed? इसलिए what is the important clinical aphorism whenever you are treating the patient with warfarin? First 3 days, when you start warfarin, add heparin. After 3 days, factor 7 also will fall down, 9 also will fall down, 2 also will fall down, 10 also will fall down. Then bleeding, anticoagulation will be superior than procoagulation tendency. Suppose if you don't follow this, and if you give only warfarin, what will happen? Protein C, protein S will form, natural anticoagulants have fallen, procoagulant tendency has worsened, and there will be thrombi forming under the skin and leading to skin necrosis, which is called warfarin induced skin necrosis, is a complication which will develop in the patients, is a very, very important rule which you should not basically forget. Okay, doc. What is the source of vitamin K? Green leafy vegetables and intestinal bacterial flora. So, if you give warfarin to a patient and he has gone to a nice dinner party and eaten all the cauliflower, carrot, wonderful, because vitamin A is important for eyes, somebody told in the newspaper, and you did not explain him what is the problem if you take warfarin with greens. Greens will affect warfarin levels. Warfarin, for that matter, is a dirty drug. It is like the best friend's anger. Even the slightest thing can affect a sensitive friendship, kind of a thing is warfarin. If patient takes rifampicin, warfarin get affected. He takes a small anti-allergic antihistamine, warfarin get affected. If he drinks wine, warfarin get affected. Warfarin has a huge influence on P450 system in the liver, is what you need to basically remember. Now what causes vitamin K deficiency? If you give the patient broad spectrum antibiotics and kill all those intestinal flora, nobody will produce vitamin K. Hence there is a deficiency of vitamin K. Those who are on total parenteral nutrition have a vitamin K deficiency. And warfarin is a vitamin K antagonist, is what need to be remembered. And generally, it is the factor 7 is the first to fall, which has got a half-life of only 3 to 5 hours, is what I want to underscore. Now, for heparin we use APDD. Can we straight use the PT in case of the vitamin K deficiency? PT is basically compared with the normal standardized value of that particular laboratory, which is called INR, International Normalized Ratio. So it is given as, how is the PT report will be? 1, 1.5, 2, 2.5, 3, 3.5, 4, 4.5. What is the meaning of that? Compared to a normal person's PT, how much is the prolongation of the PT is there in this given particular patient? Right? Now, somebody has a procoagulant tendency, you are giving warfarin to him. How much you want to prolong the INR? Therapeutically, 2.5 to 3.5 times unless INR is prolonged. Your warfarin is insufficient. Warfarin is insufficient. Another thing is, how much warfarin should be given to a patient? Is there any standard? Is it 2 milligram acetrom, common tablet of nicumarol, the congener of warfarin? So 2 milligram, 3 milligram, 4 milligram, how much you need to give? It all depends on many factors. What factors? If a patient is a strict vegan, waking up he eats 2 carrots, and for post breakfast he eats only vegetables. He is like a throughout the day vegetable eating guy. For him 5 mg warfarin also will not move the INR even by 1 step also. And some other guy is there who is typically receiving lot of antibiotics, already has a vitamin K deficiency. In him, even 1 mg you give, he will start having epistaxis. So there is no uniform warfarin dosage for everybody. You need to start with some empirical value, 2 milligrams for example. Ask the patient to check his INR after a couple of days. If the INR is prolonged to 7 or 6, nothing to worry. He need to keep a vitamin K injection in the fridge. And he need to take an injection if the bleeding diathesis is there. Don't get biased by only laboratory value. Okay? So that is how you basically manage. Then suppose if there is a severe bleeding, if your patient is on warfarin, then you replenish the clotting factors by giving fresh frozen plasma. Very simple. Then you have a coagulopathy of liver disease. This is a favorite question of the examiner. All clotting factors, liver is Matrubhumi, is the mother, except which coagulation factor? Already we discussed now, von Willebrand factor is not produced in the liver. Today night only when you go to the mess having dinner, start shooting these questions. They will, your classmates will feel, already started, very good, very good, very good. They lose confidence, they won't write their final year examinations also, and there will be no competition for entrance next year. Because half competition you killed already. So that's the reason, doctor, you don't have that sharp shooting classmates. MBBS mein the whole fun is in the mess only, no? Mess mein questions पूछने वाला sharp guys will be there, and they will be threatening the existence of the lesser mortals among the classmates, and they will be treated with divinity. When ultimately results come, the divine force is found to be failed, debarred in the exam, and the guy who was everyday sabotaged, his hope had been robbed, he will be getting distinction. So there will be some silent mutants and expressive mutants among the classmates. But what I discovered ultimately is, during our days we were never silent mutants. थोड़ा पढ़ के 10 जने को डराने में experts था medical college में. The whole fun in being a medical student is to threaten your classmates with bombarding questions. So, but that turned out to be a good habit only. It is not wrong. It is the intellectual enthusiasm we need to have after all. Passion is all about it. Now, doctor, in liver failure, why there will be bleeding diathesis? Have you seen a cirrhotic patient with terminal liver failure who is into bleeding diathesis? Very commonly you come across in AMC. Why in AMC? Saraya, Venkataya, they drink absolute alcohol also. Ultimately liver is totally gone. They will die in your hands with diffuse mucosal bleeding, hepatic encephalopathy, and die. So that's the reason coagulopathy of the liver disease of alcohol is very common in our India, because we don't have food to eat but alcohol available to drink. So that's the thing. Decreased clotting factor production, vitamin K absorption is affected, and those who have liver disease have portal hypertension, hypersplenism, and that will basically break the platelets and worsen the bleeding. Diathesis is what need to be remembered. And liver disease में GI bleeding is very common, and in fact one of the 5 child pukes criteria of the prognosis in cirrhosis, what are they? Banana. B for bilirubin, A for albumin, N for nutritional status, N for neurological status, and the abnormal PT. Child pukes criteria of deciding the prognosis in liver disease. Prolonged PT is one of the criteria. Then we come to a very important area called inherited hypercoagulable states. Very important topic. Why? You have a 28-year-old sweet looking Geeta Menon, news reporter, was our patient. Paraded on midnight 1 o'clock with coronary event. MI. A young sweet female, it is the time her heart should be stolen by somebody. Where is the question of her heart being sabotaged by a foolish ischemic event? Next day what will you do? If any young patient below 30 comes with a episode of stroke or heart attack or DVT, procoagulant profile you will send. What is the procoagulant profile? In that what will you send? Antiphospholipid antibody syndrome, protein C, protein S, factor V Leiden. What is factor V Leiden? Have you heard factor V Leiden mutation? Normally what is the fate of the coagulation factors, doctor? When coagulation cascade begins, a inactive factor become active, and after calm hone ke baad active factor in turn will become inactivated. But factor V, who will do that inactivation program? Somebody must also be there to do the disappointment also, no? It is the antithrombin. Antithrombin आके factor 5A को बताएगा. बस enough is enough. Too much of activation is over. Time for you to shut your mouth and sit down. Factor 5A बोलेगा, I am Leiden factor 5. Who are you? After all, I don't care you antithrombin. And this factor 5A which is not inactivated will lead to thrombus. So some people have a congenital mutant or mutation of the factor V Leiden, which is not ready to get inactivated by the action of the antithrombin, is what need to be remembered. That need to be detected. So summarize, doctor. Homocysteine, antiphospholipid antibody, factor V Leiden, protein C, protein S congenital deficiency, antithrombin 3 deficiency. Homocysteine levels I already told, no? They need to be evaluated in any young, and antiphospholipid need to be evaluated in every young patient who suffers from a hypercoagulable state.